Hi, I am Dr. Thomas Scotton's avatar. These lectures have been created and reviewed by Dr. Scotton, but they are for educational and informational purposes only. This does not constitute and should not be construed as medical advice, therapy, diagnosis, or treatment recommendations of any kind. All caregiving decisions should be made in consultation with professionals. Welcome to Lesson 12 of the Family Caregiving Program, Infection Control in the Home Environment. Infection prevention does not require turning a home into a hospital. It requires understanding how germs move and interrupting that movement at the right moments. Germs can spread through hands and respiratory droplets, contaminated objects, food, water, blood, urine, stool, wound drainage, and medical equipment. Older adults may be more vulnerable because of chronic illness, wounds, devices, or immune suppression, or changes in the body's defenses. Like falls, infections are serious, common, and often preventable. The foundation is hand hygiene. It is one of the most effective ways to prevent illness. Gloves, disinfectants, and masks cannot compensate for missed hand hygiene. Use soap and running water. Use soap and running water when hands are visibly dirty or greasy, after using the toilet and before eating. Wet your hands with clean running water. Apply soap. Rub all surfaces for at least 20 seconds. Palms, backs of hands, between fingers, thumbs, fingertips, around nails, and wrists. Rinse under running water. Dry with a clean towel or air dry. Use the towel to turn off the faucet if the situation requires. When hands are not visibly dirty, use an alcohol-based hand sanitizer containing at least 60% alcohol. Apply enough to cover every surface and rub until dry. Do not wipe it off early and keep away from flames. Clean your hands before preparing food, before assisting with oral care, a wound, catheter, or medical device. Clean them after toileting or perineal care, after contact with blood, and after handling soiled laundry. Move from clean tasks to dirty tasks. If you must return to a clean area, stop and clean your hands. Wear disposable gloves whenever contact with blood, urine, stool, vomit, or wound drainage is anticipated. Choose the correct size and check for tears. Put gloves on immediately before the task. While gloved, do not touch your face. To remove gloves, pinch the outside near one wrist and peel the glove away, turning it inside out. Slide bare fingers under the remaining glove at the wrist and peel it over the first glove. Discard both safely. Then clean your hands immediately. Never wash or reuse disposable gloves. Use correctly for protection. These words are not interchangeable. Cleaning uses soap, water, and friction to remove dirt and most germs. Sanitizing reduces remaining germs to a safer level. Disinfecting uses a chemical product to kill germs. Clean, high-touch surfaces regularly. Doorknobs, light switches, faucet handles, and toilet handles. Clean more often after visitors. Bed rails, counters, phones, and remote controls. During illness, focus on the surfaces the sick person touches. Never mix bleach with ammonia, acids, vinegar, or any other cleaner. Dangerous gases can form. Open windows. Store chemicals in original labeled containers away from food, children, and pets. Never apply to skin or food. For body fluid spills, keep others away. Put on gloves. Absorb the material with disposable towels and clean the area. Then disinfect with a product appropriate for the surface. Discard waste without squeezing. Remove gloves and wash hands. Handle soiled laundry with minimal movement. Do not shake it because shaking can spread material to surfaces. Wear gloves when body fluids are present. Wash with detergent using the warmest water allowed by the label. Dry completely. Place disposable briefs and gloves in a leak-resistant bag. Used needles require a puncture-resistant sharps container. Devices like oxygen equipment, catheters, and feeding equipment require their specific care plan. Do not invent a cleaning method. Devices like oxygen equipment, catheters, and feeding equipment require their specific care plan. Do not invent a cleaning method. Ask everyone to cover coughs and sneezes with a tissue or elbow, discard tissues, and clean hands immediately. Improve ventilation, avoid sharing utensils, and follow clinician advice about masks and staying away from others. Clean hands and surfaces, separate raw meat, cook to safe temperatures, and refrigerate promptly to avoid foodborne illness. Know the person's baseline. Infection may appear as fever, chills, fatigue, loss of appetite, or general decline. New confusion, unusual sleepiness, or sudden weakness may be important warning signs in older adults. Assess promptly. For skin and wounds, report increasing redness, warmth, swelling, pain, red streaks, or new drainage or foul odor. For the urinary tract, report burning, new urgency or frequency, difficulty urinating, or lower abdominal and side pain. Sepsis is the body's extreme response to infection and is a medical emergency. Seek immediate care for worsening infection. Confusion, difficulty breathing, extreme pain, or feeling very cold and clammy, call 911 for severe breathing difficulty. When reporting, be specific. When the change began, temperature measurements, symptoms, and intake and output. Do not start leftover antibiotics or share another person's medicine. Professional infection control is about right timing. Let's finish with 5 quick questions. I will pause for 5 seconds before revealing each answer to reinforce learning. Question 1. When is soap and water essential? When hands are visibly dirty, after using the toilet, after contact with stool or vomit, and when caring for C. difficile. Question 2. Do gloves replace hand hygiene? No. Clean hands before the clean task as appropriate, and immediately after removing gloves. Question 3. Must every high-touch surface be disinfected every day? Not in most healthy households. Clean regularly and disinfect when someone is sick or at higher risk. Question 4. Can bleach be mixed with another cleaner to make it stronger? Never. Mixing chemicals can create toxic gases. Follow the product label carefully for safe use. Question 5. Which signs may indicate serious infection or sepsis? Worsening infection with confusion, difficulty breathing, extreme pain, or feeling very cold requires medical attention. Remember the 4 takeaways. Hand hygiene is a strong defense. Use gloves correctly. Disinfect when indicated and report signs early. Thank you for completing Lesson 12. Infection control is about doing the right action at the right time. Download your workbook today. This concludes the lesson. Please review the safety disclaimer on your screen. Thank you for your commitment to caregiver education.